Hello.
Hello.
How are you?
Good, how are you?
Oh, I'm a little weak today. Yes, hello. Hello.
Hi.
Hello. I'm a little weak today, girls.
We have chairs over here, darling.
Do we have any little fellas in here today?
No fellas.
No fellas. I'm on the look for a little fella for my daughter. She's not married yet.
Not married yet, huh?
No. Oh, are you gonna help me today?
Hello. Hi, Miss Charlotte. How are you today?
Oh, honey, I'm a little on the weak side today.
Oh, well, let me check your arm in really quick.
It's
Okay,
over here. It's
Tell me your name.
Charlotte Watkins.
Okay, what's your date of birth, Miss Watkins?
1/14/32.
Okay. Do you want me to call you Miss Charlotte or Miss Watkins?
Oh, Charlotte.
Charlotte. That's a
Yes,
pretty name.
thank you.
Well, tell me how you're feeling today.
Well, you know, I've had colon cancer 7 years ago.
Okay.
And my congestive heart failure.
You breathing okay today?
Oh, I'm a little short of breath, but
Okay.
my oxygen saturation is good.
Yes, you've got pretty pink
Yes.
cheeks. Your skin is
Yes.
very pretty.
Thank you. But I'm so weak today. I need some help with my bag.
Okay. All right. I would love to
Yes.
help you.
Well, honey, it smells horrible.
Okay, well, that's okay. You know what? I go to the bathroom and it smells horrible too.
Well,
It's a part of life. And
my
that's okay.
husband could rip them with the best of them. I miss that little fella. Yeah. But it does smell, honey.
Okay.
I'm sorry.
Okay, that's all right. It's my job and it
Okay.
doesn't bother me if it doesn't bother you.
Okay.
Would you like me to open a window? It's just pretty outside.
Well, I wouldn't want the kiddos to get all cold.
Okay, all right.
Okay.
Well, I'm okay if you're okay. Do you mind if I wash my hands and put on my gloves?
Oh, yes, hand hygiene,
Yes,
honey.
ma'am.
Yes,
Yes, we always have to wash our hands.
yes. That would be important.
Okay.
Yes.
So what else has been going on?
Oh,
How's your daughter these days?
oh, she's so busy. She's a medical examiner.
All right. Does she watch all those fun shows on TV? Those
Oh,
freak me
she
out.
does her own shows.
Oh, she does.
Yes.
Cool.
I don't understand all that technology.
Yeah, I don't
I don't
either.
know how they do that.
I like to help people feel better. I don't like to.
My hands just, they're not working today.
Okay, that's all right. I will do that. Do you mind if I lay that across your
Oh,
lap?
no.
Let me get some
That's
stuff.
okay.
I'm gonna call for another clean clip. Here we go.
Yeah, don't lose those, honey.
I
It's
know.
expensive
Oh,
these
yes,
days.
ma'am. I know. I'm sorry, I shouldn't have dropped it on the floor.
That's okay. We can put a
You mind?
little bleach on it.
I'm gonna raise your bed up because my back is, after 17 years of nursing, it's killing me already.
This hump on my back from when I was a nurse. You gotta take care of those backs. Yes, ma'am.
I wanna bring you up to where I am because I'm short stuff.
Oh,
I'm kinda short.
short and sassy. Yes.
All right, let's see.
Okay, I can't real see real well today.
Okay, well, we'll take care of it. No worries. So do you do this all by yourself at home?
Yes,
Okay.
it's, sometimes home health will come. Uh-huh. Those ostomy nurses,
Yes.
the wound and ostomy nurse.
Okay. Yes. I was going to ask you when we finished if you would. She may have some neat things that we have in our facility. That there's some that like pop on like a Tupperware container. Have you
Yes.
seen those? That might be a little easier for you to handle at
It
home.
might help my fingers
Yes,
and the skin integrity.
yes, yes,
Yes, I
sometimes,
don't want a wound.
no, we don't want that.
No.
So we're gonna get you really good and clean down there.
Okay.
Make sure, I'm gonna look at your skin and make sure you don't have that.
Just
Okay.
remember, it's real embarrassing, honey.
Okay.
It smells.
Okay. Well, I have the curtain closed. The girls are watching on a camera outside, so it's just me and you, okay?
Okay.
All right. So I'm just gonna get some wipes ready. Might be a little cold. And I think while I'm here, I'm just gonna go ahead and change the whole thing. Is that okay with you?
That would be good. I'm sorry it's such a mess. It
That's quite all right.
wasn't sticking too well.
Don't worry about it. Okay. Let's see if I can pull it off real easy.
Oh, yeah. Gotta be careful there.
That looks
Does
wonderful.
it look good?
It looks great.
Oh, good. Yes.
Real good. Okay. The stoma is pink. Okay, I've got a cold rag. I'm gonna wipe some.
Ooh, that's chilly.
But your stoma looks wonderful. It's nice and pink and we want it to be pink.
Yes.
That means your intestine is healthy
Yes.
and your skin looks fantastic. You're doing a really great job at home, taking care of that.
It's hard work, but I'm so glad. Oh, see, there's that smell again.
It's okay. Not bothering me.
Okay. Those precious little children out there, they seem to be struggling with that.
Are they?
Yeah.
Well, see, do you mind if I tell them about it
Oh,
real quick?
please do,
Okay.
yes.
These are junior students.
Oh, they're the babies.
Yeah.
I was a baby nursing student too.
Yes, and they are always eager to learn, and they
Yes.
have not, some of them have had a patient with colostomy in the hospital, but we want them all to experience it and to know how it feels to have
Yes.
one, and how to take care of it, and to be
Yes.
sensitive about that, so.
Okay. It's
So,
embarrassing. Yeah.
yeah,
But I'm glad to be alive, not have cancer.
that's right,
Yes,
that's right.
yes.
We're glad you're here
It
too.
was in my sigmoid.
Mm-hmm, okay.
Yes.
Yes. So this is the stoma. Let me move your little gown. I just
Yeah.
don't want you to.
But yes.
Okay.
Okay.
So this is her stoma, and it looks pink. It looks healthy, and it's kind of plump, and we want that tissue to be that way. We want to look at the skin between the stoma, make sure there's no breakdown in there, or it's not bleeding, or there's any ulcers or irritation from the fecal matter, and then everything looks good to me. If it were to be a discoloration, kind of a purple color or black, that would be
That's not
bad.
good.
Not good. That would be
No.
bad. And so if you see that happening at home, you would need to tell your doctor right away.
Oh, yes,
Okay.
yes.
Okay. So I have cleaned the area and it's dry now, and I'm gonna put my stoma adhesive on just to protect her skin for the next time we pull the wafer off.
That's some good stuff.
Mhm.
Yes. It's pretty sticky.
It is. It is kind of like a paste. We're gonna let that dry for just a minute. And then, do you have one of these at home, Charlotte?
I do.
Does this measure your
Yes,
stoma? Okay.
It's usually that size right there.
Okay. Do you mind if I compare?
Sure, mine's blue
Okay.
at home.
Okay.
Yes,
And this one's kind of a green color. So
sure.
that's too big, okay? And then this one is a little too big. And so Charlotte's right on the money.
Yes, if
It's
it's
about right there.
too big, then that bowel eats at my skin.
Mm-hmm.
It's kind of like a baby's bottom.
Mm-hmm.
If you leave poop there, it gets raw. So it's gotta be cut real good for your stoma, 'cause those wounds hurt
Mm-hmm.
and they
You
take
sure
a
do
long
seem
time.
to know a lot about this. And
Well,
remind me,
7 years.
7 years, okay?
Yes.
Wow,
They didn't have this stuff when I was a nurse.
they didn't.
No,
What did they have when you were nursing?
well, they had some of these bags, but not how they stick now.
Okay, I see.
Yeah.
Would you have to just keep it on with a strap or something?
We used a strap
Oh dear.
like they did with, the female time of the month. They used to
Oh,
have
I
those
see.
straps.
Mm-hmm.
Yes, to hold their claws into place. Yes.
Wow, we've come a long, long way, haven't we?
Yes, we didn't have gloves when I was a
Oh,
nurse.
I can't even imagine.
Bleach was a good friend.
Did you just wash your hands all the time?
Yes, ma'am.
Were your hands raw?
Yes, ma'am, they were.
Right, I think it's stuck on there.
Oh,
So
don't
you-
forget that clip.
Yes, ma'am,
That
I've
poop
got it right
just go
here.
rolling out
I
on
know
the
it.
floor.
I've got it right here, but
Okay.
before, I think what I'm gonna do is, I forgot to order it, but I'm gonna order those M9 drops.
Oh,
Have you heard of those? I'm gonna get those.
Yes.
Put those in just a little bit so it doesn't bother you next time. I know
Yes.
you're bothered by that smell. Doesn't bother me, but it'll just make it a little easier for the next person.
I use Pepto-Bismol at home
And that works too.
because it's cheaper.
Mm-hmm.
Yes, this stuff is expensive.
Okay.
And
I'm just
one fold
One fold, yes,
has
because
two clicks on the clip.
1, 2.
Yes, 'cause it
Okay.
come undone and
Oh, that's a
make
bad
a mess.
day, isn't it?
It's a
Yes.
bad day, my friend. Yes, that's a bad day.
All right, Miss Charlotte, I think that is secure.
Oh, thank
What
you.
else do we need to do?
Well, my friend Megan was gonna show up.
Okay. Do I need to go get her?
Well, you can help
Okay.
her.
Okay.
That helps.
Okay.
Thank you so
You're
much.
welcome.
I'm
You
just
have a
so
wonderful day.
Thank you.
I'm glad I could help you.
Thank you, thank you. Oh, yes. Thank you. It's hard these days.
Sorry, it was hot in there. You're covered. Yeah. No, you're covered, 100%. Good?
Yes, thank you.
All right, dear. Ooh, that one's right.
That one is right. Jay's been, this is my daughter Jay. She doesn't have school today and she's been waiting to spray the spray. But we wanted to give it real, and the colostomies really do smell really, really bad. And the patients are often very mortified by the smell. So it does smell. All right, how'd that make y'all feel?
You can be honest.
It was just like so real, and it was like I don't know. As of right now, I don't think I could do that. It was just
Thank
really-
you for being real.
Mhm.
Thank you. Why couldn't you do it? Do you know what it was? Was it the smell? Was it
It
just?
wasn't the smell. It was just like you have to be confident with that. Like you have to be like for sure and like make the patient feel like. Cause I feel like I would be like I would scare the patient like, what? But I don't want to do that to the case. Like I want to make them feel like, oh, like no, I got this, you know.
Thank you. Any others?
I think it's just kind of real that we're actually, that's their intestine, I think, right there.
Mm.
And that is something that's actually,
You can come touch it.
No, but like, how does it feel like the patient?
What
Can
do
you
you-
feel it when you touch it?
It's got nerve endings. It
I
should
know,
have nerve
that's
endings. Yeah.
weird. That feels so weird.
It's squishy and kind of slimy. Like,
Yeah,
it's, and it's like it's a mucus membrane.
Mm-hmm.
It really is.
And it's probably just like a wound. If you've ever had a really large wound, you know, that you had to watch, it just feels like that. It has nerve endings and it's not gonna hurt when you touch it, but she's gonna feel sensation when I clean it. It shouldn't hurt. But yeah, it's,
It is, it's an inside part on the outside, so it is,
Yeah,
it's a
they're
little
never
weird.
supposed to feel that.
yeah. So you are invading someone's personal space. And so, yeah, so to be really careful, you know, getting in near her and being cautious of telling her exactly what I'm doing, when I'm gonna touch her. It might be cold. This paste might pull on your skin a little bit. This is why we do what we do. And then she was very knowledgeable and had 7 years of experience of doing this. So listen to your patients, let them teach you how to take care of and do what they need to do to take care of their situation. Always listen to your diabetics. I mean, they know how they feel, and they know when their blood sugar's dropping and what to do. It's not always textbook. And so if she wanted, you know, one that snapped on versus a wafer that stuck on her skin, or if she wanted to clean her skin the way she did at home, you know, I would have allowed her to do that. You always include your patient into their care and promote independence and dignity for them to care for themselves. And so she made it very comfortable. Now you're going to have patients that aren't going to feel that way, and they are very, you know, taken aback, and they have a flat affect, and they just may turn their head and let you just do your thing. So.
Did anyone notice that Charlotte mentioned expense or keep this? Colostomy items are very expensive. And depending on where a person is in their insurance, if they have insurance, if they're Medicare, if they're Medicaid, they may only get like 10 bags a month. So they have to wash and reuse their supplies frequently. And so they're very picky about how the wafer is cut, how much of it, because you know, that they have to save part, they're very picky about that stuff. So you've got to make sure you really, really listen to your patient. A lot of times they'll just rinse their bags out and hang them up. Like when you go to, if you work home health, they'll just have bags like hanging around and drying in their bathroom because they're so expensive. So
They may have just one clip.
one clip,
It's been used for years.
so, and as Charlotte was talking about, the two stages of the clip has like 2 parts, and if you want to make sure it fully closes and, you know, you hear a click, or you make sure, because that person's bowel can just fall out, and that, I mean, the patient's already, you know, embarrassed and struggling. That's huge embarrassment if they can't, if they're
And on the grocery store in the bag, that's so.
So, yeah.
It's a bad day, as Charlotte said.
You didn't talk about burping it.
Oh, did you talk about that?
I did, but yeah, go ahead.
So the burping of the bag is essentially a fart, okay? Because when you eat and your food digests down, it will make gases, and that's what a fart is, right? So they still, with colostomies or even ileostomies, will have fart, and they'll just get air in the bag, and you just unclamp it, like if it had the ones where it just clamps down like a Tupperware lid, you could open it and burp it that way, or you'll have to unhook it and burp it. But you got to pay attention, especially with new colostomies that get a lot of gas, because all of a sudden you'll hear this pop, and the bag literally pops. So if it's getting full, you've got to get it burped, is what we call it when we let that air out. And the patients know, they know when it's coming, and if it's new and they don't know, you got to show them, so then they don't have an accident. So it's a lot of patient education. Skin breakdown around an ostomy site. Why do you think it happens so frequently?
Because how adhesive on the skin.
And
Acid.
yeah, your poop. So between pulling and tugging at the skin constantly and your bowel, yeah, they get a lot of wounds. They're very prone to wounds. So you as the nurse need to make sure that you are assessing the skin around for the skin integrity, to teach your patients to do that as well, because they can end up in the hospital with an infection, with a wound, then they have an ostomy, then you've got a wound back, and you got all this stuff, and it's a nuisance. So, yes.
A UAP can empty a colostomy, okay? Many don't volunteer to do that. And so, you know, it may be a professional maturity type thing where we are trained to handle this in a situation like this. It's much more than just going in and saying, I gotta change your colostomy today, Charlotte. Just lay back and, you know, let me do what I'm doing. I have to engage with her, and I have to connect, and I have to feel empathy and show empathy to her, and I have to engage her in the process and include her. And, you know, that's why we're registered nurses, okay? We learn to do that. We learn theory behind doing that. UAPs have a different task in their job description. So they don't just want to jump on that and do it. So part of your job as the registered nurse is to make sure that that is taken care of. It is something you can delegate, okay? But it is ultimately your responsibility to make sure that that colostomy is taken care of, either by the UAP or yourself, okay? And so I want to deliver the best care to my patient, so I'm going to ensure that that is taken care of, and I'm going to just do it myself, okay? Now, you know, you'll feel, there's a struggle. You'll just see nurses just shy away from it, and they're in denial, and they just are like, I don't have time to deal with that, and they just leave it to the patient. And then the patient tries to do it, and they don't get it clipped all the way because their hands aren't working, or, you know, they can't see with the lighting or whatever, and then there's poo all over the bed. Well, now you got to deal with it. And so, you know, just go that extra mile. Have, you know, respect for your patient and take care of it in a proper manner so that none of that happens, okay? Bring your UAP in and say, let me just show you. This is how we're going to take care of Charlotte today. And make it an endearing situation so that that UAP cares for her. And she will take care of that colostomy as long as she is here, okay? So you can, you know, bring your team members in and use your interdisciplinary teamwork to get that accomplished. But a UAP can empty a colostomy. It is the RN's job to assess it and to change it out. Okay.
Patients are usually really embarrassed by this, unless they've come to an acceptance stage. But if it's brand new, they're scared to death, they're grossed out, and they're embarrassed. So those are 99% of the patients. But sometimes colostomies can be trained to have regular bowel movements like you would on a, you know, like you have to get up in the morning and go. So you can train a colostomy. It takes a long time to do, but they are able to be trained. So that's really cool for patients who have long-term. But
Ileostomy now.
ileostomies, I think it's just the colostomy that can.
And colostomies aren't always permanent.
Yeah.
Sometimes they're reversed, depending on the circumstances, so, you know.
And then in PD next year, you'll learn about, you know, teenagers that have colostomies. You know,
Babies
they're-
have.
Yeah, anybody can have them, but the adolescent who has to be responsible for this because it's on their body, they could be in any stage from denial, just completely not accepting of that, not caring for it, or they could be in complete acceptance and have a certain system where they wrap it and they bling out their wraps and, you know, do kind of, you know, other stuff
What
to
was
protect
that
it.
place you were saying this morning? It was an online store or something?
There's support groups and stores that are attached to those support groups for people, young people with colostomies, older people, whatever, but helping you accept it more by personalizing it, making it yours. Go online and look, you know, have a look through it, because it is very interesting. There's an Instagram account, a bodybuilder, who she was in a horrible accident, put on a ton of weight, decided she was gonna weight train, and in the process developed colon issues, colostomy. She's got all these scars and tissue, but she wears that colostomy bag, and her muscles are on point, and she's proud of it because she worked hard to get there, and the colostomy's not going to make it any less valuable to her. So
you'd have to protect it if you're active and you do play sports or, you know, do other things, because you wouldn't want it flopping about and busting open. So there's certain ways that you care for that. So that's going to be interesting as you come across PD patients next year.
So think about if you like to wear tight clothes, if you've got a seatbelt on, if you're going running, if you're going swimming, if you're going to be intimate. I mean, how Intimacy's a huge thing, and you've got a bag of poop hanging there, and you can't just take it off. You can't just plug the hole, right? I mean, those are hard but real issues that these patients face on a daily basis. If they're gonna go in, they can still have a colonoscopy. They just go through the stoma. If they get backed up like constipation issues, they put an enema through the stoma because there's no rectum to put an enema through. So it's kind of treated like a rectum in a way, like that. Do y'all have any further questions, concerns, anything we need to address a little more here?
Is it like the age range? Is it really just a whole like wide variety, or are there like certain ages that like?
Little babies that are born with their organs outside of their body sometimes have to have one, so they can have it from the time they're born. Older people, what usually causes them is cancer's a big one. Crohn's disease is becoming a really big one.
That's big in young and
in
middle
people
adults.
my age, yeah. And upper teenagers who have Crohn's disease, trauma,
Shot wounds,
stabbings, that vehicular accidents.
Someone this morning had a patient that was paraplegic,
Mhm.
and there's probably more of a history to that, but, the gut can be paralyzed as well, and it's not going to function, so you have to help it,
There's a familial polyposis is something you inherit, and it's usually picked up anywhere from 10 to 16, 17 years old, and it's that you have so many polyps, precancerous lesions in your colon that they remove the colon and you have a colostomy.
So after this, the very first question I asked was, who had a patient with a colostomy and how did it make you feel? What did we say? Cautious? Scared, okay. How do you think you'll feel now? What'd you say, Kimmy?
I said better.
I really like how y'all spray that spray because it really prepared me because I was not prepared to change it whenever I was a CNA to change a growing up, and so that first time that happened, the first 2 times I threw up, and it was terrible. I remember that. But and also when I had C. diff patient, I was just not prepared at all.
Yeah, that's a different smell.
In a weird way, I kind of wish it was like little swabs you can smell different scents to get used to them
Yeah.
before you walk into.
You're so right. Yes, it's
That's
awful.
that's the biggest obstacle.
Yeah.
And that's, I come in and I'm like, Charlotte, it's a beautiful day. Open the window. And they know. I'm just trying to be pleasant about it. I'm not going to be like, woo, this is going to really stink, so I'm going to open the window first. It's all in your approach, and it's how you, build rapport with your patient. And so she was empathetic toward you girls and didn't want you to get cold. So I chose to honor her wishes and didn't open the window. But I've got my sleeve.
Really wanted them
I've got my sleeve ready, and then of course you go into the bathroom, and then you're like,
Breathe through your mouth.
I'm ready. And so you just kind of, go back in.
Or when you put your mask on for the C. diff room, you can get some mentholatum or toothpaste.
Y'all.
Go in the supply
Chapstick.
closet.
I put
get some-
chapstick.
Yes, put that on it.
How do you think it would have made her feel if I walked in with a mask?
She was like,
A disease person, terrible.
Yeah, I know this is gonna stink. That's just you're
And
just
someone
flashing
like
red
Charlotte
lights.
who's been in for a while will think, I'm on precautions? What am I on precautions
Oh, yeah?
for?
Yeah.
What are they not telling me?
Or that nurse is not empathetic at all.
Yeah.
She doesn't care about me.
She just cares about her smell, her smelling this. So it's a huge process, and it's not just about, doing a procedure. It's
And
a
you
lot
do it
more.
for a short period of time, and they do it every day of their life.
Will most patients like want to change their own, or do they request that the nurses?
It depends on if it's new or older. Most patients who have one, it's like they went in to have a little bit of a surgery done and they come out with this colostomy. And it is a massive life changer. I mean, think about sitting on the toilet, and now all of a sudden all that's coming out in the bag and I can't control when it does it. And I'm supposed to go to this wedding and wear a tuxedo, and now I have this bag. I'm supposed to go swimming at the beach with my family, and now I have this bag. So it really depends on a lot where the person is in their terms of accepting what is going on and not. And whenever it's new and if they're trying to learn, it's